Again is Dr. Homo Cothry, the Chief Medical Officer for Dignity Health Central California Division. He has been joining us every morning here on 17 News at Sunrise. Good morning, Dr. Cothry. Thanks so much for joining us.
Well, good morning, Alex. Thanks for having me once again.
I want to first talk about what the future of the virus looks like here in Kern County. We heard from Matt Constantine, the Director of Public Health, on Tuesday, talk about how it is essential for us to continue to prepare for the worst of this virus, saying that we could see the worst as far away as October. So my question is, what are we doing right now for hospitals, healthcare providers doing to prepare for possibly a surge in cases if we're still several months away from it?
Well, several things. One, we're following all of our state mandates and all of our federal mandates. We are looking to anticipate opening up elective surgeries next week, or actually the week after, on May 4th, at all of our Dignity hospitals. We do have several criteria that we have to meet, and we do have contingency plans in place if this virus is to pop its head back up again. So we are actively preparing to open things up, which I think once the hospitals start to open up, I think it's very likely the rest of the community will start to open up as well.
Is this going to be seen as like a test, if you will, to see if we slowly start to open things up? Is there the possibility that we could go back and close it down if we start to see a spike again?
We can. We are prepared to do that. However, like I said, we have to meet several strict criteria to be able to stay open, and that includes having certain number of beds set aside for potential new patients, certain number of ICU beds, regular beds, certain number of ventilators have to be set aside. So we have everything in place currently.
We have a lot of dates that are being thrown out there. There are different studies that show when our state, the nation, can reopen for business, but there's a lot of doctors who are, giving different opinions on this. What do you think needs to happen for us to go back to normal? And do you think that it could be several months, several years before we truly return back to normal?
I don't know if we ever go back to a true normal. This might be somewhat of our norm. We will open everything up. We will, I'm sure, keep practicing social distancing. I know the hospitality industry has made changes that will stick. The hospitals have made changes that will stay. So I don't think this ever goes away.
What do you think about this summer and how there are projections that show that it's going to most likely die off for a while? And then, but again, we're hearing more and more that this is going to come back in the fall. So do you think we're going to at least get a little bit of a break for the summer months, and then we just continue to prepare for several months for another possible outbreak in the fall?
Absolutely. So we will get a break, and what will happen during that break is a lot of these studies that are ongoing currently will start publishing their data and hopefully start producing medications that we can use. So when this virus does come back around in the fall, we will be able to prescribe some of these medications to people that are having mild to moderate symptoms, and have their symptoms get shortened instead of being a prolonged process.
Now, we also know it's not just coronavirus that we're dealing with. In the fall, we start to see the beginning of the flu season, which again is something that takes a huge toll on hospitals and people around the world. How are hospitals preparing for something like this? Are hospitals preparing for this massive influx of patients come the fall?
Yes, absolutely. And one of the things we have done, and we're going to keep pushing this even harder now, is mandating that every healthcare worker gets the flu shot unless you have a specific reason you can't get it. We're going to have to limit the number of flu cases that we transmit. We don't know what kind of wave we're going to get with the coronavirus, but I think we are going to be well prepared in anticipation of the fall.
When do you think, with our curve, a couple days ago you talked about Kern County could see a surge beginning on Sunday. Do you think that we're going to quickly start to see our curve flatten in the coming days and weeks?
Yeah, I believe so. And one of the things that I think is helping, actually two things. I think we as a population in Kern County are doing what we're supposed to with the stay-at-home order and the social distancing. But I think the other thing that's helping is what Kevin was talking about just a bit ago. The weather is warming up. So I think there's a lot of factors playing into this, but I think as a people are doing our part.
All right, Dr. Hamal-Kothari with Dignity Health. Thanks so much for joining us as you do every morning, giving us an update on the coronavirus pandemic here in Kern County. We definitely appreciate it, and we will see you on Monday morning at 6:30. Have a good weekend.
Thank you very much, Alex.
All right.